let me introduce our guest for the evening. Caroline Rober de Massey is going to help you to explore ways to improve your pelvic health. Caroline is a pelvic floor therapist at St. Luke's University Health Network's Center for Pelvic Health. She has experience working with both trans feminine and trans masculine folks, has had extensive training from the Herman and Wallace Pelvic Rehab Institute, and she continues to take advanced courses to keep up with the latest research and techniques. She's passionate about finding creative ways to allow patients to achieve their goals through exercise, education, manual techniques, and some humor. And she is a true ally of the trans community. And I will also disclaim this, that she is a personal friend. I've known Caroline for many years. So with that, Caroline, I'm going to turn it over to you. Welcome to Trans Topics.
Well, thank you, Corinne. Quite the introduction. I hope I can kind of live up to it. So again, my name is Caroline, and I work over at St. Luke's in Southside Bethlehem. And my pronouns are she, her, and hers. And since Corinne invited me to do this talk, or actually, I believe I might have begged her to have the opportunity to do this tonight. I've been so excited. I am extremely passionate about physical therapy, but mostly about pelvic floor therapy. I think that being able to give patients some independence and giving them confidence about, having either pain-free intercourse or staying dry. Those are all great things that we're able to achieve here. And so every day is a great day for me recently, so definitely. The clinic I work at treats people of all genders, and we take great pride in making everyone who comes to our door feel welcome to and listened to. Most issues that our patients have are extremely sensitive as well as private. So they often go through a collection of different healthcare workers before they get to our door. So they need answers, and hopefully we're able to help them with that and give them validation to their symptoms. I'm 52 years old, and I wish I had known all of this when I was in my 20s, but it's, so hopefully I can teach you a few things. The goal of this presentation today is to introduce you to pelvic floor therapy, go over some different types of problems we can run into if our pelvic floor muscles aren't working properly, teach you some tricks, also review some more specific ways pelvic floor therapy can help with trans folks.
Perfect.
I'm hoping that this is my first Zoom presentation ever, so I hope that you will be patient with me. And also, if I say something that is not right, that's not correct, that might be offensive, please, I encourage you, actually, I really hope that you will call me on it and throw it in the chat, and Corinne can help me navigate through that. So here we go, let's see. All right, so common conditions that we treat are bladder issues, bowel issues such as constipation, sexual dysfunction, menopausal changes, pelvic organ prolapse, prostatitis, buttock, tailbone, anorectal pain, vulvodynia, abdominal, groin, pelvic pain, levator ani, and I'll go into more details about what these things are a little bit later in the presentation, but pudendal neuralgia, scar tissue massage. We do a lot of scar tissue massage. Post-mastectomy pain syndrome, pre and post gender reaffirming surgeries, and any hip abnormalities and many more conditions. The pelvic and all its muscles. There are so many different muscles, and most of us, I would say, are very disconnected with what's going on down there. But that's what we do. We, the pelvic floor therapists work with muscles, and they are no different. We test them the same way on a scale of 0 to 5. Are they able to contract? Are they able to relax? Do they have is there any tension anywhere? But that's what it is. There's a whole lot of them. And contrary to what some people believe, all genders have pelvic floor muscle. So just a little food for thought, because a lot of people are like, oh, I don't think I have, my husband doesn't have pelvic floor muscle. Yes, he does. What to expect on your first visit when you meet with a pelvic floor therapist, obviously a little bit different than if you were having, a knee problem or back problem. A pelvic floor therapist will do a full intake of your past medical history, because any information that could be relevant that you might not think is relevant, but you had a hernia repair, well, that could throw off some things. So that's important for them to know. They will assess your posture, breathing pattern. We're very big in breathing. Any abdominal restrictions. They will do a full examination and assessment of external, internal genitalia, your back and your hips. There are so many types of incontinence. I'm just going to go over a few, but those are the big ones that we see. Stress incontinence would be your leakage with sneeze, cough, laugh. Urge incontinence is more like that sudden urge to urinate and sometimes a loss of urine. Mixed incontinence is a mix of urge and stress incontinence. And nocturia would be more like if you're getting up during the night a couple of times. Overactive bladder, frequent and sudden urge to urinate. And voiding dysfunction, that could be like more like maybe not a good stream, like poor, intermittent. Fecal incontinence, loss of feces, and chordal incontinence is more urine leakage during sexual activities. So Corinne, I have to take a little break just for a second. I've somehow lost part of my presentation.
No worries.
Yeah, so give me.
So while you're
Yeah.
finding your slide,
Yes.
Somebody did ask a question about, is there any sort of network or directory of pelvic floor specialists, maybe nationally or regionally?
There is actually. Okay. Yes. Hang on just a second.
And is there like a national, like, I don't know, the National Association of Pelvic Floor Specialists or something like that?
There is. So the APTA has, and I can. I don't even want to throw this off by sending you a message now, but so let me just go back to my presentation here. There's the APTA and there's Ehrman and Wallace, which is where I took most of my classes.
Herman and Wallace.
Yes. So they have actually a directory of, anywhere in the, really they have Canada and the United States that I know of.
Perfect. I'm going to find them real quick and put a link in the chat for folks.
Okay. All right. I think I'm all right now. Sorry, I'm back. So when they do the assessment, when they PT will do especially the assessment of the genitalias or the pelvic floor muscles, if you want, usually they'll assess to make sure that you are able to do a Kegel, but they'll also look at it without inserting a finger. Okay, whether it's rectally or vaginally, depending on your genitalia, and depending on your gender, obviously. One long Q-tip is also used with gentle pressure to address sensation, because it's really important. If you don't have good sensation, then it's very hard for you to do a Kegel. So if you had a vaginoplasty, and depending on where you are in the healing process, if you don't have good sensation, it's hard for you to be able to contract some of those tissues. So we always check on that. And yeah, that's pretty much it on that one. All right. And then, okay, so that one we did, sorry. All right. So one of the things that's really important is that if you go to the doctor, Corinne, today, and you say, I'm having some, some incontinence, and they'll tap you on your knee and they'll go, okay, go home and do Kegels, because that's usually what doctors will say when people experience a loss of urine. And what we've discovered, as pelvic floor therapists, is that it's so important to know, is there any tension there? Because if you're having pelvic muscle tension, and I'm asking you to do more Kegels, it can in fact make it worse before it makes it better. So our job is to kind of identify where the problem is. If there's tension, we always want to address tension before after that, we can get muscle strong all day long. But if there's tension, we need to address that first. All right. So the big question is, again, do we Kegel or not Kegel? So that's something that we can help, our patients figure out. Okay. So if they're having any kind of pain with penetrative intercourse, the last thing I want them to do is do a Kegel.
So maybe you can just take a moment and talk about what a Kegel is.
Oh, yes. You're rushing. That's my next slide. I think.
Oh, okay.
So yes, let me teach you what a Kegel is. Absolutely. Hang on a second. Let me move this over a little bit. Have this. Sorry. All right. I'm just going to get rid of this. Oops. All right. I'm going to just review this slide, and then we're going to move on to our exercise to do a Kegel. Are you okay with it? Okay. So what happens if my muscles are tense? Okay. What do we do in pelvic floor therapy to help you with that? So we teach people how to breathe, meditation techniques, reverse Kegel. So I'll teach you about that after. We do a lot of intravaginal or intrarectal myofascial release. So that's why this kind of therapy is so important to build. You can't just walk in and I can say, okay, you're just going to lie down on the table and we're going to do some intravaginal release. There needs to be a rapport that's established and a trust, because we unfortunately ask a lot of questions that are going to help us help you, but can be sometimes personal. So it's so important to, to establish a good foundation at the beginning. And I think we're fun and we're compassionate. So I don't know that I've ever met through all the courses I've taken a pelvic floor therapist that's not compassionate and that doesn't care to make things better for someone. So we do a lot of dilator and wand training. Certainly for, for people that have had a vaginoplasty, that's, something that we help with, because it's not, I can give you, I can give you a set of dilators and tell you to go home and tell you, okay, you just need to, take this and put it in there and leave it there for 15 minutes. And the next week you have to put it one more, I don't know what you call it, but like one more level, a little bit deeper. That can be a little overwhelming just to be looking at this and saying, I got to do this every day. And from my understanding, you have to be doing it 3-4 times a day, right? At the beginning. I think I don't know that we make it more pleasant, but we make it less scary. And we also will go we will literally get down on the ground and say, okay, so if you put yourself in this position, you'll be able to insert it maybe a little bit better. If you have your partner help you, that might feel a little more comfortable. There's a lot of different things that, we've come up with for people using dilators that they're like, oh, I didn't know I could use it that way. Yes, you can. And it's just whatever's going to make it comfortable and help you achieve your goals is what, what we try to help with. We do a lot of biofeedback, which basically is electrodes that we put on your buttocks, and it shows us what your pelvic floor muscles are doing. So if they're too tense, I'm like, okay, now Corinne, you have to imagine yourself, you're in the Bahamas and the palm trees, and to try to down train your muscles. And if they're not strong enough, I'm like, you got to squeeze a little harder. You got to give me, a little more. So I guess that's pretty much it. And we also teach some safe exercise. And we go over, when people are ready to have penetrative intercourse, we'll go over what are the best positions? What are some positions that they might be a little bit better? And I don't know, Corinne, have you even this? I just kind of just stumbled onto this. This is called the O-nut. And I don't know if any, right? I'm like, oh my God, this is so clever. So we have different tools that we try to, educate people, teach people that, it might help them achieve their goals a little bit faster. And yeah, so that kind of sums it up. So now let's do a Kegel. So I'm going to ask the group to do a Kegel with me. And just remember that when you're doing a Kegel, no one should know. You're sitting in church and you're doing your Kegels because you're coming to see me tomorrow and you forgot to do them. So if you can just go ahead and do a Kegel and kind of like see how it feels. And now I'm going to teach you, hopefully I'm going to teach you a little something. Maybe you're already doing it right. I have no idea. So this is the real, like the true way and the most that you can get out of doing a Kegel is I want you to take, so we're going to do this again. I'll give you the instructions and then if you can go ahead and practice.
Yeah.
I want you to take a nice deep belly breath. So that means you got to put your hands on your belly and that belly's got to get big. I know that most of us are always trying to suck it in, but today you can go ahead and just make it big. And on the exhale, so I'm taking my big breath, and on the exhale is when I engage my pelvic floor muscles and lower abdominals. Pelvic floor muscles and lower abdominals work together with your diaphragm. And that's when the magic happens. You can't just do like pelvic floor, it's cute, but you're not going to get what you need out of it. So if you can go ahead and take a nice deep breath. And as you exhale, imagine that you are zippering up from your pelvic floor muscles up to your lower abdominals.
Now, the way that I've always heard about doing Kegels is that, so it's like if you're, this is going to probably sound horribly gross, but right, imagine that you really have to pee or you really have to, go to the bathroom, number 2, right? And you are trying to prevent that, right? So you're trying to tighten everything up.
Right.
Yeah.
So that's a Kegel like most people do. Okay. And that's okay. Like if I'm going to sneeze, I don't have time to start going into my breath and everything. This is just not going to work. Right. So I have to do a Kegel to prevent from leakage. But if you're doing Kegels to be training your pelvic floor muscles to become stronger, you need to incorporate your lower abdominals and your breath, because then that's when it's really strong. And you can tell, we can tell a difference if someone is doing, like if we're, I do a lot of cueing, like vaginal cueing with some of our patients. And you can tell a big difference if someone engages their lower abs. So you can, anybody can test themselves, but it's kind of a fun thing to see the difference. Okay.
So you don't want to just feel the muscles clenching way low. You want to feel them coming up more towards your core.
Yeah. So it's really like, I'm going to stand it. I don't know if you can like I'm really like, it's got to like zipper up, right? So I'm coming, like I'm Kegling and zippering up.
Got it.
Okay. But I'm not but at no time when I'm doing a Kegel am I holding my breath, right? So there's, some of it, we like to hold our breath sometimes. The stress incontinence excuses. We hear it all the time here. And I don't know that anyone in your group at the moment experiences any stress incontinence, but I know that they might at one point, or their mother or someone has had stress incontinence. So I think it's something nice to, to go over. So we always hear, the doctor said, I need surgery. I need surgery. Absolutely. Nothing can be done. I'm very busy. I don't have time. I prefer to take medication, which to me is like, why would you want to take medication when we can help you, work those muscles? I had babies. It only happens when I get out of a chair. Prostate cancer. We see a lot of male after, they had a prostatectomy. I'm old. My grandmother had the same problem. It's got to be genetic. I'm out of shape. So just to say that we've had patients that are 92 years old and have leaked for 30 or 40 years, and you can help, you can make a difference. So that's just, a little something to remember. And if you all of a sudden wanted to, go to the trampoline park or run a 5K, or even just enjoy a good laugh with girlfriends, we teach you with tactile cueing, like I went over before, and a biofeedback software program, which I already reviewed. And it's a question of like, how strong are your muscles? Do they have the ability to relax? what's their endurance? Like, are they good for the first sneeze, but after 3 sneezes, you're out? So we can teach you with that. And also, yeah, I guess you always want to think of when you're going to like either jump on a trampoline or do something that's a little more, that exerts you a little more, even if it's picking up a cat litter bag that's 30 pounds, you're putting a lot of stress on that area. So you want to make sure that you're engaging your pelvic floor muscles, and you might be able to get away with it for a long time. There's like, I don't leak, I don't have that problem. But if you're not, it's like having a tube of toothpaste. So my body's a tube of toothpaste, and I don't put the cap on. So the cap is just a little bit open. So you're putting a lot of pressure.
And, and I may be getting ahead here, Caroline, so tell me if I am. But, for many people, women of trans experience, right, their concerns are, dilation and, I can't get the depth or maintain depth comfortably. And then, frankly, surgical recovery, right? So, if you're going in for, confirming surgery, whether you're transmasculine or transfeminine, there's a whole lot of work going on down there, right? And, we want to make sure that, our patients recover quickly, but then also are able to maintain their physical well-being down below, right? After these things go on. So, hopefully at some point we kind of can talk a little bit about those things too.
Oh yeah, no, absolutely. Perfect. And I can jump ahead and go there if you.
I think these are very important points. I just wanted to make sure that people who were watching kind of knew that stuff was going to come up.
Oh yeah. Like I said, the first part was more like what are pelvic floor muscles, and then more specific to but thank you, Corinne. So urgent incontinence, just to go through that quickly, is if you're that's if you're on 22 and all of a sudden you're like, I gotta go like right now. There are ways to control that, just like if you're getting up during the night, it's the same thing. But you're on 22. If you panic, you're just gonna it's just gonna make it worse. So we usually teach people to take a couple nice deep breaths and to relax and to do mini Kegels. So that's where your little Kegels come in, Corinne. You could do those. Those are just like stop the pee, relax, stop the pee, relax, stop the pee, relax. That sends a signal to your bladder to kind of tells your bladder it's not time yet, so that you can wait till you get to the wall or you get home. Okay. So I'll jump over that one. It's not that interesting. Nocturia is one of those that like you're getting up during the night 3 to 4 times. There can be a lot of reasons for that. It can be, did you have a glass of wine a little too late, or did you have, any of the irritants? But also there's habits. Like if you're always getting up 2 to 3 times a night, you could probably look at your watch and go, yeah, it's 2 o'clock in the morning because I always get up at 2. So the same trick you want to use on 22, you want to use during the night. So if I wake up, I got to pee, I do a couple quick Kegels, it can make the urge go away. I know that most people are probably thinking that does not work, but it does work. So it's worth a try. Next time you run into trouble, try it.
So for many trans women, they're put on a hormone blocker that actually is like a water pill, and it makes us pee. So spironolactone, right? So, and I remember when I was on spironolactone, I was getting up 3-4 times a night sometimes, and always watching how much water intake I had, which isn't necessarily healthy. So this is really important.
No, it is. And the reality is like it's hard because your bladder goes into spasm. And is it going into spasm because of certain medications you're taking? Is it going into spasm, like I said, because you had that glass of wine? But what it does, it's lined with a muscle that's called the detrusor muscle, and it goes into spasm. And when that happens, if you just go with it and get up, it's just going to continually get irritated. It's like, remember, Corinne, we're old enough to remember this, batteries on the cell phones. They would always tell you, don't charge it unless it's dead, right? So if you get up during the night and you go to the bathroom and you pee a lot, then maybe it's worth your time. But a lot of times what happens is if you're continually emptying your bladder is like, I don't have to work. I'm just going to wait till, they take me to the bathroom again. So you do want to try to break those urges, but it's not easy because you need a little bit of patience. All right. So nobody wants to talk about this next one, but we must. And that, especially when you're now, like, I've had my anatomy for 52 years, 3 kids, couple, little weight gain here and there, but overall it's been my anatomy. So I know how to, I don't know what the right word is, but how to use it. And I know what's going to help it. I know what's not going to help it. When I have brand new anatomy, it's also really important to understand that you need to protect, especially if I'm going through the process of, going for a vaginoplasty, like, you want to be able to protect what the surgeon has done and all the steps you've taken, right? So this is it, the famous prolapse. Ugh. So I have this cute little guy that I have to show you because he's absolutely adorable. So this was sent to me from a business that sells products like dilators and stuff like that. But they also have this cute little guy. I don't know if you can see him. Can you see him? And what he does is that he shows you what a prolapse is. And that's when you're not careful with your pelvic floor muscles. And this comes out. Not adorable. So who can get them? Anyone can get them. It doesn't matter what gender you can get. It doesn't, like, it'll be more with if you have female genitalia, but you can still create, if you're not using your pelvic floor muscles, you can run into a lot of trouble. You can get more like hernias with if you have, male genitalia. So can pelvic floor therapy help with a prolapse? Absolutely. What can cause it? There's a lot of things. Again, if you're not using your pelvic floor muscles properly, if you had babies, injuries, if you're constantly forcing when you go to the bathroom, I don't know, do you have constipation, Caroline? Can I ask you that? Like, do a lot of people have constipation? Because that can be, especially with like different medications, if you cannot pass your bowels easily, it can cause a lot of strain. We always hear of the, Uncle Bill that died on the toilet, years ago, just from like straining so hard and holding their breath, So anyhow, so in pelvic floor therapy, we can definitely help with that. I'll go over this because it's not that interesting. Okay, so constipation, that is a big thing. That is an enormous problem in the United States, whether it's what we eat, things that we're exposed to, the water we're not drinking. So we always want to make sure that you're able to pass your bowels easy. It is such a big problem. It can cause back problems, prolapse, bleeding, fissure, polyps, megacolon, fecal incontinence, which is not really that cool because that can be embarrassing. So we can help with that. Perfect poo is always how much water you're drinking. Half of your body weight in ounces of water is the usual recommendation, unless you've been told by a cardiologist. That's like, oh no, you got to, maybe tone it down a bit. But so in my case, I weigh 150 pounds. They would expect me to drink 70 ounces of water. And that does not include if I had water with my, in my coffee. That should be like straight up water. Proper amounts of fiber is also.
So I want to make sure that I heard that. So I weigh, 235 pounds. So I'm supposed to drink 115 ounces of water a day.
Yeah, well, okay, so there's also a scale of, at some point you can't, yes, but I would say you're probably supposed to drink at least 80 to 100 ounces of water.
So that's like 10 glasses of water.
Yes, that's a lot of water.
That's a lot of water, yeah.
It's a lot. And then what happens is that people go, oh my God, I'm already going to the bathroom like 12 times a day. What's going to happen? But your body needs it and will do what it needs to do with it. It's not all going to be spent in the bathroom. Yeah. So bowel posture is a thing that we work with our patients with. The famous squatty potty. The guy made $1 million on the Shark Tank. There's actually a reason that we love the squat. I own 2 squatty potties, not that you need to know that, but it's, are you familiar with the squatty potty, Corinne?
I am, yeah.
All right. Yes. So it really does
It's basically like a little bench you put in front of your toilet to help you get the right
Right.
posture.
And but for us, that's not really what I mean, it's cute, but at the end of the day, it allows your muscles to relax, and it makes the chute, the poo chute, if you want, a whole lot straighter versus having kinks. So that's the reason that it works. We teach you how to do bowel massage. We do a lot of like visceral mobilization and like belly massage to help things move better. Especially when you've had like surgeries, whether it's to remove something or to add something, all of a sudden things have shifted, things have changed. You know, it's like if someone has a gastric bypass and they lose 100 pounds, you can't imagine that things are going to be where they used to be, right? So we need, you know, so we'll work with that.
Well, and I think this is a really great time to kind of pause for just a second and say, you know, so after, so actually I know a woman today who just had her confirming surgery today.
Oh, good. Congratulations.
Right? Yeah, so good for her, right? So dream come true. But is that, you know, you are recovering from this, you know, massive surgery that involves, you know, rerouting of plumbing and, you know, everything else that's going on, lots of muscles being moved around and lots of sutures. Is that if you're not drinking enough water and to maintain throughput, right, effectively, you know, through your bowel, and you start having to strain a lot, that can actually, you know, damage the work that your surgeon did.
Oh, absolutely. Yeah, for sure. And, you know, and again, it's hard because I'm sure it's going to be, you know, I imagine, I'm not sure exactly what the recovery is, like how quick, but anything that you can do to help yourself, drink the right amount of water, still moving, you know, is really, really important to try to, you know, avoid putting extra tension on that area if you want, you know. So this is just a quick little thing. We're not going to do it together, obviously, but there's if you ever want to figure out how fast this food goes through you, there's actually an attachment here for the Blue Poop Challenge. You eat 2 blueberry cupcakes, and you kind of see how long does it take for it to work its way out. But you can also go the simpler way and eat corn. Corn has this weird way of staying the same going in and coming out. Not sure how that works, but it looks the same. So they'll say, like, if you eat corn on a Monday, don't eat corn any other days, but wait to see how, when it shows up. And it can be a telltale sign of how your gut is doing too, right? So if it takes over 48 hours, things are moving too slow. And again, that can cause tension on your pelvic floor muscle, on your back. It's like kind of all interrelated. So I put an attachment. We're not going to do it, but I think it's a fun little thing to do, is the I love you massage. And that's basically an abdominal massage that we teach, I would say, most of our patients how to do. So if anything, it's to kind of like, you know, get the colon to work a little bit better and to move a little bit better. Okay. Oh, I don't want to do that. How do I stop? All right. So this is my last slide, and then we're going to move on to a little more specific stuff. So the canister, which I kind of touched over at the beginning, is your powerhouse. It is your powerhouse. Most of us do not want to bother with small little core exercise because we want to look a certain way. But I always tell people that if you, you know, would you want your mechanic to build you a brand new car starting from the outside with like super pretty colors? Or would you want him spending all of his time on the inside, on the motor and fine tuning everything and then building the outside? It's a little bit the same thing with all of us, really. So, you know, if you can see, the canister is like basically your abdominals, the diaphragm, pelvic floor muscles, and your back. That's where all the magic happens. All right, what can we do for trans folks? Well, and I hope that people will ask questions, and if I don't know the answer, I will certainly look it up. I'll try to go over some of the stuff that, you know, we know and that we've come across. So more specific PT issues with trans folks, orthopedic and pelvic floor issues, urinary function, and that's more like with like maybe, you know, if they had a urethral lengthening and, or they have some urethral restriction, and all of a sudden, they sit down on the toilet and they're peeing on the ceiling, we can help with that. There's no need to, well, there might be, but there's a good chance that we can help, that they don't have to have any more procedures to fix that. We do a lot of, scar tissue massage and myofascial release to be able to release that. So we do that. We help with bowel function, sexual activity. Again, it's always, and pain-free dilation, which is a big thing. And that kind of touches what I talked about at the beginning with, it's finding ways that's going to make it less like, I got to do the dilation again, right? So we try to, whether it's to put some like meditation tape and to show you different position. And really, if you're in a relationship, have your partner help you. Why should this be? Because you're doing this, a lot of times people want to do this because, they might be in a relationship and they want to bring it to the next level. So we can help you with that. Definitely. Surgical scars. We do a lot of scar tissue massage. And also lymph drainage. Lymph drainage is a big thing. If we had a lady not that long ago that had a vaginoplasty, and really, she was doing great. But she had a lot of like very specific like swelling in that area. So they can, one of our therapists here is trained. She's a certified lymph therapist, sorry. So she'll do some of that as well. Just going over some muscle retraining, like, okay, so how do these muscles work now? So we can help with that. Returning to sports or other activities, which is a big thing. Like, when can I get back to, riding a bike, and that will, like, I have my PT tomorrow is going outside. We work like right on the south side Bethlehem. She's going to go running one of our patients, because it's like, okay, let me see how we can help you get to this goal. And so do a lot of things like that. And binding and tucking side effects, we try to help you, if obviously we understand the purposes of binding and tucking, and we appreciate it, but we also want to make sure that people are educated and understanding, okay, like if I'm doing this all day, what can possibly happen, right? Can we find ways of making it a little bit better for you? Urinary issues like dysuria, hesitancy, okay, not being able. I know if you I had a patient that had a mitoplasty and could urinate standing up, but it was just complicated. We literally had to go through retraining of like, okay, I've been sitting for 40 years, and all of a sudden I got new plumbing, right? So we're able to, to help with that. It's kind of like the straining and the spraying. It kind of goes in the same that I talked about before. There was a study, and you might have seen this already, Corinne, but there was a study done with 72 patients between 2016, 2018, that showed that when they saw them pre-surgery, 42% of them had pelvic floor dysfunction, which is a pretty high number when you think about it, and 37% had bowel dysfunction. Significantly higher for those with a history of abuse, which sometimes we see even, right here with some of our different patients. They come sometimes with a few suitcases, right? Don't we all have a few suitcases? Let's be honest. But the rate of resolution of pelvic floor dysfunction and bowel dysfunction was 69 and 73% respectively before. After attending pre and post were even better outcomes.
So I think that's really important. Plus, I just saw the last bullet point too about dilation, right?
Yes, yeah.
And that, all too often, I hear stories of trans folk who, they, are having issues with peeing effectively, or with dilation, or with pooping, or whatever else it is, right? And often the first sort of people they go to is the surgeon. And that doesn't mean that they shouldn't be communicating with their surgeon, because they absolutely should, right? But,
right.
going back for revision surgeries takes more time off from work. It creates more issues in terms of cost and things like that. And often, not always, but often, physical therapy can get involved and, get to a good resolution.
Absolutely. And it's not like we don't always avoid surgery, but for us, that's always our main goal. Like, is there anything, that we can do to make it better? I have a patient just discharged him tonight, 4 years of pain. Sent him to every specialist and this and that, and did really well. He's pain free. I don't know. It's a nice thing, and things that he was actually too embarrassed to even share with his wife what we were doing here. But he says, but it's working. Like, I don't, so it might be, awkward and everything, but I think it's definitely worth looking into, especially like I said. So now that if you were to go for surgery and after you realize, I'm having problems with, either peeing or with using the dilators, I would hope that people would have gone and said, what, maybe I should check this out. Maybe I should check pelvic floor therapy and see what how we can help you. Preoperative visits will work a lot with breathing, posture. Again, myofascial release. If you're going into surgery and you already got some stuff going on, guess what? There's a chance that it can make things worse, or that you're not going to have the outcome that you have been dreaming about for however long, right? So anything that we can do to prepare your body better before going into the surgery, I think is a win-win. Even like I said, with the visceral mobilization, scar tissue mobilization, making sure that your muscles are working properly. The other thing that I was reading was it was interesting. It was Holly Ehrman, and she's the one that founded Ehrman and Wallace that I was telling you about, the organization that put together those courses. She was saying that now she's actually talking to surgeons that are doing gender reaffirming surgeries to tell them, you got to move these bodies during the surgeries. You got to move the legs. You can't just have someone in the same position with their legs up or whatever position, depending on the surgery, for 6 hours and then expect them to what, because they do, like, when you think of where they're doing the surgery, it can affect their legs, their back, and everything. So they're saying, just move the leg, every so often, whatever, their recommendation is, I'm not sure. But that's something that we appreciate as, being in physical therapy. That's kind of what we do. We want people to move, right? So that's what we go over. Postoperatively, again, it would be the same thing as, with the breathing, but we do a lot of the dilator training. And that, I think it makes it nice, I think, because I feel like people know that we are here to help them and make the process easier. There's nobody that wants to hang out with a boring dilator, right? That can be actually painful. But if we can teach you ways to be able to progress up the line and to be able to, whatever your goals are, because some people, they don't want to have penetrative intercourse. So that might not be the goal, but they want to not have pain. They want to be able to, whatever. So that, those are definitely goals that we would love to help anyone reach, because I think it's a pretty neat thing, and that kind of goes over the lymph drainage, like I talked about a lot. We'll do that post-operatively for sure if there is any issues with, the lymphatic system is very, very important, but also very sensitive. And anytime you're going to play with some tissues and move things around, the lymphatic system can be affected. So, and some of the, possible downfalls of tucking, it, can cause some urinary issues, some mechanical damage, some urethral meatus. So like urethral, like restrictions and things like that. You don't really want that. Infertility, pain. Again, if we can help like troubleshoot, because that's what we do. We're like, okay, let me look, this is what your goal is. How can we get you to that goal and keep you safe? Perfect. This is just a little attachment that, some trans tape that I saw. and then also some health issues associated with binding. Again, appreciate why someone would want to do that. Absolutely. But can we make it so that you're not like, causing some rib changes, or that you're not affecting your posture, and that you're still able to breathe? I mean, breathing's pretty important, right? So that's, or digestive issues and things like that. And obviously there's muscle wasting, abdominal pain, restricted chest expansion. As you can see the slide, there's definitely a lot of things that we're looking at the whole thing. You don't just walk in and go, okay, like I have this problem. We're looking at the whole person and try to see like, how can we, help you reach your goals. We would even, we can even help with sizing the right thing. Cause like if you're sizing me for a perfect binder and I'm going, and I'm sucking it in, well, guess what? When I get it, it's going to fit because I can get in there, but it's going to be a little too obstructive. Like you want to make sure that you're able to breathe. And some chest binding resources, I thought, and these are all my resources. That's it. That's all I got. Great.
So a couple things. So we have a question. So one of the questions is, so for pre-operative therapy, right? And I think, we probably want to look at this from the transmasculine as well as transfeminine perspective, but how long before surgery should you start looking at taking part in physical therapy?
I would say that if you so typically we see our patients once a week. Okay. That's usually like, it's not like because a lot of it is like, okay, what are you going to do at home? Right. There's, you come here once a week, we might fix up the home exercise program, give you more. So I would say that if you were having your surgery, let's say November 1st, just to pick a date like that, I would say that you would want to come probably like 3 to 4 sessions, like a month, like 6 weeks before, or 2 months before, whatever, depending. But again, it kind of depends on, like if you did a checklist, do you have this? Do you have that? Do you have this? If you have a little more, especially if you're having pain, I would hope that, if you're having any kind of pain, I would hope that you would reach out before to any pelvic floor therapist that's in your area. Because that's just, to me, I'm just saying, if it's just like to come before surgery for, 1 or 2 visit would still be great. 3 or 4 would probably be, maybe up to, but I think it's more, and after too. So it just depends on, what you would be coming for. Does that answer?
I know that, I had physical therapy for my hand here, a couple of years ago, and it was like 3 sessions with lots of homework in between, but then basically told me this is what you need to continue to do.
Sure.
Right. So if I think that if you, again, you're having your surgery on November 1, you want to probably make sure you've scheduled your first PT sessions, in September, which in the case of many practices might mean that you need to start scheduling in July.
Well, I was just going to say that. So at the moment we're scheduling in November, right? So that's just, that's kind of the, and this is at this clinic. I'm not saying, there's many more clinics. Not as funny as us, but there's a lot of more clinics. But yeah, so I would say that, yeah, you would definitely want to make, at least call ahead and say, when do I need to commit to this? And also like ask questions, talk to therapists. Like I want to make sure if I'm going to, if I was going personally to a pelvic floor therapist, I would want to like do some homework. I would want to even maybe have a conversation on the phone with the therapist and go, these are my goals. This is what I'd be coming here for. Like, do you feel comfortable helping me? Do you feel that you can help me? I would definitely have that conversation with things like what we see here. You want to make sure you feel comfortable. That's too important.
So, and I guess maybe sort of a related question to this is, so, and you may or may not be able to answer this one, I don't know, but is that so for insurance coverage, is it some sort of pre-clearance required? Is it something that you need to work through, for example, with your surgeon?
So, and I can only speak about this clinic now. We take direct access here. So you could be like walking down the street and go, oh, they have a, not that we don't really have advertisement outside here, but regardless, you could come in, schedule an evaluation without a script. And then we need to get a script from a consent, whoever, is sending you feel could send you here within 30 days of treatment. So really, if you were only to come, let's say twice, you wouldn't even need a script. You would just go direct access. You don't need to go, to the chain of command of getting a script from a doctor. But that's at this specific, I think St. Luke's works that way. I don't believe Lehigh Valley does, but Lehigh Valley has fantastic therapists as well. So, but if you were in a situation that it was going to take some time to get a script, direct access. Yeah.
So, but it's probably important to keep your surgeon, for example, where we are located in the Lehigh Valley, there is not a surgeon that does, bottom surgeries, right? So you're going to Philadelphia, you're going to New York, or you're going to Baltimore, or Chicago, or Cleveland, or Montreal, right? And so, or Thailand. So you want to make sure you're consulting with your surgeon so that, number one, you can hopefully get insurance to cover, and number two, that they're in the loop.
Oh, absolutely. And with the direct access, it's still run through the insurance, by the way. It is still run through your insurance, just so you know. But no, absolutely. For something like that, 100% you would want. I'm just saying, if it came to a point that, regardless, even if you wanted to go for some other form of therapy, when it says direct access, you have direct, you don't need a script. But I think that it's better to work as a team effort and to make sure that, and the surgeon might say, yeah, make sure that they, cover this and talk to you about this, some surgeons are very much, I think physical therapy, certainly pelvic floor therapy, is getting a lot more recognition. I know that I believe, and you can correct me if I'm wrong, that some gender reaffirming surgeons actually require it right now.
Yeah.
Right.
Yeah.
So you would think they're on board. You shouldn't have a problem getting us, to us, it doesn't make a difference. We just want you to be able to get whatever help you need. So it doesn't matter if you come direct access or with a script.
Yeah. And this is just sort of a comment, is that for people who are seeking insurance coverage for these things, your insurance plan may not specifically mention physical therapy or pelvic floor therapy as a covered piece, but you can fight up for that. And of course, the business case that you make to the insurance company is that, 2 or 3 sessions with a physical therapist is a whole lot cheaper than having to go back for revision surgery.
Yes. And our, certainly the 2 PTs I work with and many that I've worked at Lehigh Valley and St. Luke's, all are always looking like they'll write letters, they'll contact insurance companies and go, listen, I can keep, so-and-so for 2 more sessions. We're going to get, when we can justify it and there's, like a goal in mind and there's progress, there's really no reason that, but again, the insurance game is not my game. I'll tell you, I could never do that. But
that's why we're having a session on insurance in a few weeks.
Oh yes, absolutely, and because there's a lot of little loopholes, and I don't know how to navigate that system, and lucky for me, I have not had to. So
So another question. So you held up a product earlier, and I'm familiar with things like Kegel balls and other devices, or that you can buy at a sex toy store often, right, to help you improve, your strength in your pelvic floor. Is there any particular products that, you feel like you can recommend?
Yeah. So let me show you. I just got them. This is and again, I'm not this is not a paid advertisement. This is just a company that we use. Am I allowed to even say this? I don't even know.
Sure,
but,
absolutely.
Okay. So these are pelvic weights. Okay. And it's from a company called Intimate Rose. I can't even say it, but Intimate Rose. And they're really super comfortable. Okay. And they have different, I don't know if you can see it, but they have different, so one is really light and everything. But you have to be able, obviously you have to be able to insert the whole thing. I'm just saying, depending on what, the reason you're doing it, you have to be able to insert it. And that's really to be able to, like, you can do your dishes while you have this and, holding it. So that's one of the things. Let me see what else. We have, like I said, we have the dilators. We don't carry the dilators. I think that most surgeons are recommending following, but we help people that, if they have to order them, we can, but typically they get them pretty quickly. Am I wrong?
Yeah, they usually get them from their surgeon. Yeah.
Yeah, they usually get them from the surgeon. So they'll usually bring it in when they come for their session. And again, that's when we go, okay, like, let's figure out how we can make it a little more pleasant. So.
Good. Awesome. Well, we'll give people another minute or two to ask any questions. But in the meanwhile, Caroline, I really want to thank you for investing your time and your research and your preparation in this. Really want to thank you so much for your allyship and for caring for so many patients. I know that I've personally been contacted by some of them to show appreciation. So thank you for that.
Oh, thank you. Thank you for having me.
Yeah. So it doesn't look like we have any more questions. We do have a couple thank yous though, and awesome. So that's great.
All right.
So,
and again, if you, if you have any questions that come up later, Corinne, please feel free to reach out to me.
Sure. So actually, you do have a question. Somebody said, can you go back and talk about tucking just a little bit more?
Sure.
Yeah. So, and I think that, while you're kind of going back there, so, what are so many women of trans experience do tuck to try to get a better appearance, right? But,
Sure.
There are, just like with any kind of practice, there are, positives and negatives associated with it. And so some things that could potentially create a challenge. So maybe kind of talk about what some of those challenges might be.
Yeah. So right here. So do you know this trans tape? The trans tape, do you know what that is?
I'm familiar with the product, yeah.
Okay. So I guess ultimately is if you're tucking, basically, if let's say you're tucking your penis between your buttocks, right? Or you're kind of tucking your testicles up in that groin area. Basically, they want, like, if you're doing it, you do it a couple of times a week, it's one thing, but I would imagine, right, at some point it just becomes that's how you want to go out in the community or even at home, right? I would imagine. So they're just saying that you don't want to just use, like, you don't want to use anything that's going to be too restrictive, that you can't breathe, because that can definitely cause pain. It can cause infection. It can cause damage to, like, you can have urinary problems because of it. Even problems with ejaculation after, like, if you're, constantly tucking it. And also, I was thinking something. Oh, they talked about infertility as well. Because if your testicles are, if I can't really describe it, but if they're tucked constantly for like 10, 12 hours a day, they have to be able to breathe. It's a little bit like, think of, those women in Africa that you put those, they have those beautiful, rings. Rings around their neck. They look absolutely stunning. It looks perfect. They present themselves, for whatever they want to wear them. If you were to take those away, their necks would snap. Right? Because the muscles don't have to work. They, and the tissues could break. That's the other thing. You want to make sure, if you are tucking, you want to make sure that you examine your tissues all the time to make sure that there's no breakdown, there's no redness, or swelling for that matter. You don't really want to get, excessive swelling either.
Yeah, I think, a way to sort of think about it is like, if you have a garden hose that you put a kink in it, right? Because, it's supposed to be straight, I guess. But if you put a kink in it and you leave that kink in it for a long extended period of time, that hose can break or tear, right? Mm-hmm. And that can happen with your urethra.
So, exactly. It's very sensitive.
Yeah. And that can obviously have impact on future surgeries. So whether you're tucking or whether you're binding, they are kind of normal practices in our community, but it's important to take a break and let things sort of normalize. To your point, always examine, make sure that you're not getting abrasions or any damage or things like that. And then the other thing I will just say specifically in regard to tucking is that because you are moving, the penis back towards the anus, really important to be clean down there, right? Because you can very easily get a UTI.
Yes. See, yeah, you see, I wouldn't have, absolutely. Sorry, didn't even, absolutely. That would be very important. I mean, it's always important, but it would be that much more important just to make sure that there is no, risk of infection or anything like that. It's a little bit like, I mean, it's not quite the same as, like having a, free bra free day, but sometimes things just need to move. They need to be able to breathe. So although I definitely appreciate why you would want to do it. We have,
It's just like with transmasculine people wearing a binder, right? The general rule is, not for more than 8 hours, certainly not more than 12. And, probably not 7 days a week, you take a break periodically to.
Sure. And it depends too, like not to say, but to kind of piggyback on the binding, like if you're starting, let's say as a 14-year-old, and you start using the practice of binding your chest, you're not even fully finished growing, if you want, you know what I mean? So just even educating like the younger generation, because I know, 14.
Your rib cage isn't fully developed yet.
Right? No, so all of a sudden if you're, so anyhow.
Yeah. Well, hopefully that helped out. I don't see any more questions. So Caroline, again, thank you so much for your time. Truly appreciate it.
Thank you for your patience with me.
Oh, no worries. And as a reminder to everybody, you will be able to see this presentation shortly on our YouTube channel. So thank you so much, Caroline.
Thank you.
Have a good night, everybody. Bye-bye.